Thank y'all so very much. And welcome to the first in the Save HIV Funding Campaign's training series for our Summer of Advocacy, focused around how in which we can engage with our legislators. This first one is an in-district legislator engagement training, focused also on how in which people have in-district meetings, how in which folks have different engagement with their legislators and have continuous engagement during the Summer of Advocacy, knowing that there will be a long recess in August, along with some very big decisions that will be coming up in in Congress this year. And we want to make sure that our legislators are hearing from our communities and understand the importance of what these funding cuts can do to our communities. My name is Max Boykin. I'm the manager of the Save HIV Funding Campaign. I am based in Atlanta, Georgia, and I use he, him pronouns. Thank you all for joining us for this inaugural training. I will pass it on over to our panelists to introduce themselves before getting into our agenda. And I will start for our first panelist to be Barb, if you don't mind introducing yourself.
No, I'm very happy to. Hi, everyone. Welcome. Barb Cardell. I use they, them pronouns. I'm the program director with the Positive Women's Network USA. I live in Boulder, Colorado. Back to you, Max.
Thank you so very much, Barb. And I will pass it off to our next panelist, Jenny.
Thanks, Max. My name is Jenny Collier. I use she, her pronouns, and I'm the founder and CEO of Collier Collective, which is a public interest advocacy firm that helps coalitions and individual advocates around the country work on healthcare and public health issues, as well as criminal legal system reform, youth justice issues across the country, mainly focused at the federal level. And I'd like to turn it over, Max, if it's okay, to my colleague, Bill McCall. Thanks.
Thanks so much, Jenny. I'm Bill McCall. I'm a senior consultant for Collier Collective and continuing to work on behalf of Prep for All, the HIV Medicine Association, and AVAC with the Save HIV Funding Campaign. We've been working really hard to get folks set up for in-district meetings, working very closely with Max. Max, did you have any additional thoughts? Oh, he, him pronouns, and I'm in Washington, D.C.
Thank you so very much, Barb, Jenny, and Bill, for those introductions. With that, for our agenda today, we will do a small legislative update. I know many of you are on our noon calls every Tuesday, noon Eastern, that we host, where we do both legislative updates and action alerts that folks can take action to be able to save HIV funding and defend Medicaid. But we're going to have Bill go ahead and give us a legislative update. Then we're going to hear from Barb and her work in Colorado around setting up in district meetings and having that continued engagement with their legislators, and how in which this has been a continuous learning and growing piece of how in which to continue to move legislators and build that relationship with them. Then we'll talk a little bit about like how in which you set up a coalition of folks to be able to have those meetings, and then a little bit more of the basics of setting up an in-district meeting, and then talk about a little bit more examples of legislative engagement, and then we'll have time for questions and wrap up. With that, I will go ahead and pass it on over to my colleague Bill.
Thank you so much, Max. I really appreciate it. I am really appreciative of being here. I always feel like it's an honor to work with so many dedicated people who are fighting the good fight to ensure that people living with HIV are fully able to access programs and be able to fully get the resources that they need. And in fact, that's what this whole Congress right now is about, is that we are currently engaged in a fight for resources with a very conservative Congress that has been seeking to cut back on those resources. And it's up to us really to go talk to them and explain to them why it is that we need these resources and how we're going to both what the incredible return on investment for those resources is, but also how it actually helps people living in the United States. And I think, there's sometimes some cynicism about approaching members of Congress or talking to folks who sometimes seem to be indifferent. And yet the truth is that many members of Congress are extremely responsive to the folks that are in their districts, particularly as constituents. I think Barb will talk about some instances that are even surprises that people are listening, and so I think it is actually worth that effort. And I have to say, I think that folks can do meetings out in the district and do it a little bit more authentically and realistically than we can here in Washington because they know that we're coming by and that we're part of this entire group that's out there in this battle for resources. But when they're talking to a constituent in their district, both staff members and the members of Congress, they are very much more respectful and much more, I think, likely to listen because they know that that's real and it's coming from their own space. All right, so with that, I'm going to give you a very quick overview of what's going on in Washington. Like I said, the broadest possible category, we're in a massive fight for resources. There are two simultaneous budget battles that are going on. One of them is for what you will sometimes hear called mandatory spending or non-discretionary spending. This is spending that Congress has just authorized and that just allocates basically itself. And that spending is includes Medicaid, Medicare, SNAP. There are other categories. I won't go through them, but those are the main ones that concern us. Where we're at, the House has already passed what is the House Resolution 1, which they are referring to as the Big Beautiful Bill Act. I have to say it's one of the ugliest bills I've ever seen, in part because it actually would produce the largest cut to Medicaid that has ever occurred. It would also produce the largest cuts to the safety nutrition program, SNAP, and then finally, excuse me, the Supplemental Nutrition Assistance Program, SNAP. And then one of the impacts of having such large cuts actually ends up, but they actually add increases. That actually ends up also requiring a cut from Medicare. So I think our messaging on that is that we oppose the cuts to Medicaid, Medicare, and SNAP. Medicaid is literally the largest source of insurance coverage for people living with HIV and the largest source of federal funding for both HIV treatment and prevention. 40% of people living with HIV receive almost all of their care through Medicaid. Um, that's uh, that's one piece of what's going on. The timeline on this one is really quick. The Senate is going to try and jam through the bill before the July 4th recess, which starts June the 30th, to be able to try to force the issue to come to a head and to get the House to sign on. We're really concerned about this. Now is a great time to be weighing in, and not just in district meetings, but you'll see that the Save HIV Funding Campaign is going to be putting out a toolkit for Pride, but that toolkit could be used to call your legislators and to contact them on social media. All right, I said that there were two buckets. The second bucket is the regular appropriations process. Appropriations is just the process that says that Congress says, okay, we're going to allocate this amount of funding to these programs, and and once the bill is signed, it gives the Treasury Department the go ahead to actually give the funding to those programs. Right now, we are going through what I would consider to be, it appears to be a somewhat regular process that they always hold every year. The House and the Senate are in process of holding their hearings and markups, and both the House and Senate hope to pass all 12 of their appropriations bills through committee by August. There's an August recess that is also a good time to be meeting with folks. They'll try to reconcile the bills in September and achieve a final passage before the end of the fiscal year by September 30th. I have my doubts that they're going to be able to do that because there's going to be a lot of controversy about cuts that they're going to try to do. In the meantime, the administration has released a budget. The House and the Senate don't need to follow that budget. What they do need to do is go through their own appropriations process. We expect that the House will try to follow the president's budget a little more closely. The Senate appropriators have said that they're going to try to follow a more traditional bipartisan process. And we even just heard that they're trying to get that done again by August. And they're not waiting for the House, which sometimes they do. The president's budget would be a disaster if we get close to it. They do a number of different things. I just have to say they appear to be on the verge of cutting almost all funding out of HIV prevention. They seem to be eliminating the Division of HIV Prevention. They maintain ending the HIV epidemic funding of about 220 million. I'm not going to go through all of the details, but this one's really important. Basically, HIV prevention will be decimated. They also would cut the Ryan White Part F program. That includes the AIDS education and training centers, special projects of national significance, and the dental program. So it's not even true that they're trying to stay away from cutting services because they're going to cut dental programs. And by the way, the education and training centers are one of the major sources for primary care doctors to learn how to take care of people living with HIV. It appears that they may have cut the Minority AIDS Initiative. There's not enough information in the budgets that they've presented so far to fully understand that, but the skinny budget that they released earlier did call for that elimination. And then finally, one thing they do is they consolidate the divisions of viral hepatitis, STD prevention, and TB elimination at CDC and move it, along with, by the way, HRSA over to this new conceptual administration for a healthy America. They would also cut $77 million in funding. And then, of course, I feel like the other thing that they do is it appears to eliminate HOPWA, threatening really critical housing resources for people living with HIV. So there is a lot that's going on here, as Jenny noted in the chat. This is not any sort of final situation. The House and the Senate have to pass their appropriations bills. It is just what the president's wish list is. And we have the ability to impact this right now. And as I've been saying about Medicaid, but I'm also going to say it about this, a lot of this is a winnable fight. We may not win all of the battles, but we can actually have an impact and save these HIV resources. Okay, I feel like I've gone on kind of a long time. Let me just ask real quickly, Jenny, I don't know if you had any final thoughts or comments about this legislative update. And if not, we'll move to Max.
I think it was great, Bill. The only thing I would just say on the timeline, it sounds like everything's happening this summer. And while there'll be a lot of process this summer, it's unlikely that the appropriations bills will pass by the September 30th deadline. And when they miss the deadline, like most years, they basically extend funding for the government through a continuing resolution, and they'll pass those shorter level funding, usually types of resolutions until they can come to a final bill. For us, delay may not be a bad thing because it gives us more time to advocate and it gets us closer to the election when people are more sensitive. And so I just want to right size the timing because I think reconciliation is the most time sensitive thing that we're working on. That likely will pass by the end of the summer. Appropriations first drafts are happening and passing out of committee for the House and Senate in June and July, likely, but they won't be able to finish likely by September 30th. And we'll hopefully have more time to work on that issue because I just know that folks may feel overwhelmed by the amount that's going on, but I think we're going to have a little bit more time on FY26. Thanks.
Thanks so much, Jenny. And I will just say for reconciliation, the targets right now are senators. Reach out to your senators, tell them to oppose the cuts to Medicaid and SNAP, as well as to any cuts to Medicare. All right, Max, I'm turning this back over to you.
Thank you so very much for that legislative update, Bill, and for the additions, Ginny. Also, I want to highlight that there is also, as people have also said, cuts to complete cut to HOPWA within this as well. One of the things that we know we have to do is make sure that our legislators hear our voices, especially in district. We know that there will be a long recess in August, but there's also a 4th of July recess that happens as well that will be coming up next month. And one of the things that we want to highlight now is here's a story from Barb, who has been a leader in PWN for years, around how in which they have worked to continue to have that legislator engagement, how they have worked to have meetings with their legislator in district, and how they have continued to escalate, but also hone the messaging that they have with their escalators. I mean, with their legislators in Colorado. And I'll go ahead and take it away, Barb.
Thanks, Max. I always say that being in community, I'm with the escalators all of the time, and certainly see a number of folks that are on the call. I just want to take a moment and wish everyone who is here on the call a reminder and a happy long-term Survivors Day. I feel like this presentation fits so perfectly into honoring folks who have been living with HIV, living, thriving, and even struggling to survive. We show up in so many ways, places, and spaces. And as someone who's been living with HIV now for 34 years, I see you all, I acknowledge you all, and just want to say that what is happening now at the federal level is problematic and offensive and is really concerning, because what we're seeing is this dismantling of these systems that we have worked so hard and have been advocating for so long to be in place. The federal government is saying that they're trying to address the waste, fraud, and abuse, but what we know is that it is an excuse, to remove what we have worked and fought for so long. And so for everyone here who is an ally and advocate, and especially to those who are living with HIV, now is the time for us. It has always been the time, and we has always stood up and fought for ourselves and for our community. And now is the time for us to lean in further and to commit further to making sure that both the needs of our community, but the voices of our community are lifted up. And so I really appreciate being on this call and being able to share with you, a number of advocacy sort of stories that we have had in Colorado. It is easy for people to think about Colorado being like this blue state, and we have not been a blue state for very long. We were purple-ish, and we were actually red for a really long time. We were the hate state. When we were trying to pass Amendment 2 that was a ban against marriage equality, and we have been fighting hard. So we talk about our state being really an opportunity to both shift those of our people who consider themselves to be in alignment with us further to the more progressive side, and to actually take some of the more moderate conservatives and shift them over to the center so that they can see how necessary all of these federal programs are for people who are living with HIV, people who benefit from prevention services. And really, when we talk about intersectionality, everyone in our communities of color, our lower income folks, people who benefit from Medicaid, Medicare, pretty much everything that we advocate for touches on everyone's lives. And so, one of the things that I want to lift up first is that people living with HIV in our communities that support us have been doing this work and have been practicing for these in-district meetings for a long, long time. We have had the benefit of coming to Washington, D.C. for AIDS Watch for, I think this was, I won't even guess the number of years, but it's been a long time. And so one of the things that I want to recommend is, as you sit here and you start thinking about organizing in-district visits, think about the people living with HIV or prevention service experts who have gone to Washington, D.C. and have been doing these meetings, because they are already able to model what has been effective. So reach out into your communities and know that there are subject matter experts who will be able to be real keystone pieces of these meetings. Let's talk about in-district meetings. It can be intimidating to think about reaching out and trying to connect with either your elected official or their staffers. We put them up on a pedestal, but the part that we need to remember is that they are there to represent us. They are from our state. They started out oftentimes in places, school boards or other places where we have seen them, and we need to remember that they are, while they hold great power, they also hold great responsibility to represent us and to acknowledge the needs of our state. And so I just want to lift up and say that I actually have been a part of conversations with some of the most conservatives in Washington, D.C. And part of what we are able to do is to make links and connections to our needs, to what the needs are in their districts. So we have actually, believe it or not, talked to Representative Lauren Boebert back when she was on the Western Slope about HIV funding, and we were able to make connections to her around women who were having children, people who were living with HIV, and people who were on Medicaid in her district. And we actually had a really good and respectful meeting. So if we can have conversations with some of those more conservative Republicans, we need to know that we can have conversations lifting up our needs with so many other folks. So I'm going to talk specifically about a meeting that we had with Senator Hickenlooper and his staff. It was earlier this year. We started reaching out because we knew that Senator Hickenlooper was on the Health Committee, which is the Health, Education, Labor, and Pensions, and they were going to be doing some of the significant markup on the bill. We wanted to make sure that Senator Hickenlooper and his staff were prepared to talk about the impact of these cuts on people living with HIV in Colorado. They have the biggest picture of what the needs are in the state. And we were able to bring to that meeting some real specifics about what the impacts were going to be, both in Denver, but also in Colorado across the state. And it is really very exciting because we were able to bring a coalition to that meeting. And it seems like there's some magic to being able to schedule in district meetings, but really all you need is someone who can just say, we want to have this meeting and we've got this number of constituents. And oftentimes you will have a meeting scheduled with a staffer. And oftentimes the staffers are the ones that are the most experts on the impact and the connections between health and the state itself. And so by forming this coalition, having this in-district meeting, we were able to lift up a couple of really critical needs in the state, the impact about the Medicaid cuts, and to talk specifically about, in particular, the SNAP cuts and the impacts they were going to have on people living in Colorado. Here's the part that's important. You get your in-district meeting scheduled, and you're going to be very excited about it, and you're going to have a lot of people that are going to want to join. Please remember to have a couple of pre-meeting planning calls. We actually ended up having 30 people who were invited to our meeting with our senator. We had 30 minutes. So basically we would have had introductions and no time to talk about anything else. And so we had a pre-planning meeting and we had everybody list what they thought was most important that they wanted to talk about. We condensed it into 3 talking points. We asked people from the community to be able to come both with the talking points, with a story supporting the need, and then a demand/ask. We'll say an ask, but it was demand for their action to be able to shape what we needed from that meeting. And then we had time always at the end for questions. It took us 3 hours of our pre-planning call to be able to fit everything that we wanted to into our 30-minute meeting with time left over for questions. But we were able to do that, and it was really helpful to be able to do that, because not only did we have links to the documents that were then able to support what our asks were and our concerns were, but we were also able to have a variety of people who were able to speak and nobody had their feelings hurt because their points weren't raised. We also were able to bring representation from around Colorado, so the rural areas as well as the metropolitan areas. So those are the things that you want to think about when you really are coming to the in-district meetings, and they can be in person or Zoom. But here's what I want to say. This is the most important time for them to hear our voices and to connect the stories that we have to the demands and the points that we're raising around our concerns. So please lean into doing this organizing. Think about the coalitions. Max is going to talk about that next, because as we amplify our voices, now is the time that we need to be heard from, because we know the people, we know the faces, and we know the stories that these cuts are going to impact back in our own states, and they need to hear from us as well. And I think I'll stop there and turn it back over to you, Max.
Thank you so very much, Barb, for going through that, talking through all of the wonderful meetings that y'all have had, also what it took to also make that meeting happen. And what I'm going to do is talk a little bit more of what type of coalition you want to build before going in to have in-district meetings. One of the things is, as Barb had said, was you want to make sure that you have rural and urban. Especially if you're doing a statewide meeting with your senators, I live in the Atlanta metro area. Anytime that we want to meet with a senator, I also want to make sure that I'm talking to people in South Georgia, making sure we're talking to people outside of the Atlanta metro area, either talking to folks in Augusta, Athens, LaGrange, Columbus. You have to think about the areas outside of just what are the major urban areas anytime. And then if you have multiple urban areas in your state, make sure that you're also touching those places as best you can when trying to recruit folks to being able to meeting. If you're meeting with your senator in Ohio, it helps to have someone from Cincinnati, Cleveland, and Columbus, but also Akron. Some of the other parts of Ohio are also important to have. And we know that the folks are working on this also in Michigan. Having folks up from the peninsula as well is always important to have a geographical diversity when having these meetings. It also different type of organizations. Having your local aid service organization, of course, is a great one to have. Having a local CBO, and I also not having ones that are just the big know the one organizations that everyone knows. You also want to maybe have smaller organizations as well. Another great people to have a part of these coalitions are universities. One trick I've also used is if you have a university that potentially the elected official graduated from or has connections with family connections or anything, also potentially more likely to get that in-person meeting set up. So that is also something that we love to have, continue to work on, and make sure that you're also having meetings with everyone that is supposed to have to be a part of the meeting beforehand. That is best to have. One, so you're all on the same page. Like Barb said, not so you're not talking all over each other, and you're also not having conflicting messages. I also want to say you don't have to say in the meeting that you're trying to talk about saving HIV funding or defending Medicaid. What you can say is I want to defend the services or talk about like the services that we offer in your district. And this is very important, but it's very important also, and especially when we were talking a lot about the senators, but also when we may be meeting with House members as well, is having folks in the district or having agencies that serve in the district. And that should be one of the first parts that is ever put in letters, engaging around having the in-district meeting, but also when first having the in-district meeting, saying it was like, oh, we serve this many people in your district, or we serve this many people within your state, is a big thing and can also open the eyes of different legislators or their staff when having these meetings. This is an important part of being able to do that and tell that story. But again, it is also important, and you can, and I know we're talking a lot about the coalition, but you can also have an in-district meeting by yourself. That is also a thing that is okay to do. These elected officials work for you, so we talk about the coalition. Those are the strongest meetings, but you can sometimes start with a meeting where it's just yourself. Have that meeting, and then you can think about who are the other organizations, entities that you want to bring in. But also within this, I've talked a lot about the organizations. It's also important to have people of lived experience coming to the space. I think this we believe in MIPA, meaningful involvement of people living with HIV, but I think more important, it is important to have those real stories of what these cuts and impacts will do to people, and that is why it is really important to make sure that we have the different organizations and agencies in the room, but also people living with HIV, people who are impacted by this, to also be able to tell their stories. And also, when you're thinking about how in which you're setting up it, making sure that you are making sure that the individuals and the organizations' goals are in mind when having that in-district meeting. With that, to go into, break down all these basics of how to set up the in-district meeting and what you want to be able to say, I will pass it back over to Bill.
Thanks again, Max. If you don't mind, I'm going to try and share my screen here. Y'all are getting a first peek at a new target or a little toolkit on the Save HIV Funding Campaign and how to set up meetings. Jenny's been helping me to shorten this. She's going to keep me on track here to make sure that we're working out to do that. As you can see, and by the way, it's a little lengthier than this. I shortened it up so that we could show it on the screen to you without everyone having to read blocks of text. And Jenny's been encouraging me to eliminate blocks of text anyway, so we'll be doing that. Real quickly, we just talked about finding a group, so I won't go into that, but Max or myself are really, really willing to help out, and we'd like to do that. One of your steps is to figure out who your members of Congress are. And I think it's just important to note that every person has a member of the House of Representatives and two senators representing you. Particularly if you're in the States, I will acknowledge that we here in the District of Columbia, along with our dear friends like Anselmo from Puerto Rico and the Virgin Islands and our other territories, have a delegate. It's still worth meeting with the delegates because they can sometimes sit in important committees and they talk to all the representatives. Um, we have provided an in-district target list that lists all the members of the Senate. I think I could show you this document, but well, it just popped over to the um, over here. It's one that we've provided before, so I'm not gonna be able, it looks like, to show it to you, but I will make sure that that gets circulated as well. I also know that the Save HIV Funding Campaign is setting up um, a, um, a website, and we'll try and include these materials in that when that's there. The other thing to do is go to ballotpedia.org. They have a really nice, nicely set up finder for your members of Congress, and you can use your address to figure out your members of Congress. Um, and then real quickly, we really recommend, in the in-district meeting, especially if you want to do it quickly, to probably reach out to staff first. That's actually something um, that will get you a meeting faster than trying to schedule with a member. I'm sorry, I've got my meeting chat showing up there. I'll come back to your question there, Chanika, in just a minute. The it's probably worth looking up on online the office locations where they've got an office. It might help you to decide where to hold the meeting. So, for example, we know that Max mentioned Ohio earlier. The senators for Ohio have offices in various places, including like Cleveland and Columbus, I think, were a couple of them. Right now, I think targeting staffers is probably more important than targeting the members. Also, the members often have a formal online request process, whereas with the staffers, it's worth just trying to reach out. You can call their office to try to get the staff names. If you get their name and their spelling, it's usually pretty easy to figure out how to contact them. So you see here, you could get the first name of somebody for the Senate, then do an underscore, and then their last name and then the senator's last name and senate.gov. That'll get you to their, say, district director or a regional field representative, whoever you're trying to reach. The House, similar first name dot last name, not an underscore, and mail.house.gov. The House is actually easier. I will also just say if you want to figure this out and you're having trouble, you can reach out to Collier Collective's scheduler and a person who really keeps a lot of these lists for us, a guy named Brooks Johnson at bjohnson@colliercollective.org. Also, just feel free to reach out to me. My email's up here, but I'll add it back into the chat here in a minute. So the other thing is really there are basically two goals for your meeting. It's to educate policymakers about the importance of HIV programs to you, but also to your district and state, and then develop a relationship with the congressional offices and staff. And honestly, that developing the relationship is really important. As Barb mentioned, it's incredibly um, helpful to be able to reach out to a staffer that you know to talk about an issue that you're having, and they sometimes can solve things even if they're not ideologically aligned. They're going to want to try to help folks that are constituents in their districts. We did include some primary asks for the meeting. Oh, I really just like the way they do this. Let me see if I can sort out single page continuous. There we go. And that is simple. It's oppose the reconciliation package because it's going to cut Medicaid, Medicare, SNAP, and other vital programs that support people living with HIV, and then urge Congress to robustly fund HIV programs in FY26 spending bills that improve health outcomes while reducing costs. I will say that we are also developing talking points. I've got 8 pages of talking points, and I'm going to cut that down to 2 pages because no one has the time to deal with 8 pages of talking points. So that's kind of where we're at in our program right now. Um, Here's how I would conduct a meeting. I'm going to try and go a little faster here because we want to have time for questions and answers. Do a regular greeting and introduction. Honestly, it's just like going in and making friends with the staffers. Thank them for meeting with you. Introduce yourself and why you're interested in HIV, and then begin with the urging support for the HIV programs that serve you or that you work with in the state. Often it's helpful to provide background on the state or the district. Ask the staffer how familiar they are. This is where the talking points will come in. We'll have those for you. We'll also have some leave behinds that might be helpful for you. Describe the need for services and go from there. And then I'm going to just say this part right here. Tell your personal story. That is going to be the hook that is the most important for everyone, and it's the thing that people are going to remember. They may not remember, oh, there's X thousand people living in our state with HIV or anything like that. They're going to remember your story about how you had trouble accessing services until you were able to get onto Medicaid, or until the Ryan White program offered this, or that you've been having a lot of trouble accessing PrEP to prevent HIV, even though you're at risk. All of those things are there. Or if you're a person who's providing services, talking a little bit about the importance of the work that you do. Focus on local impacts, service disruption, vulnerable populations, public health crisis, job losses. All of those things are just so incredibly important. I was just at a meeting today with Representative Sarah McBride. She's the first trans person in Congress. And what she was saying is that those personal stories are the things that resonate, and it is her personal story that is actually helping to moderate some of the behavior of people around some trans issues in Congress. So I think we got really good at telling our stories during the beginning part of the HIV epidemic, and that's the thing that we really need to do. And then, to wrap up the meeting, ask them to think of you as a resource for issues related to HIV and infectious disease. Ask them how to stay in touch. If you work for an HIV services program, invite the staff or a member of Congress to visit your program or clinic. I should say, if you're hosting an event, or if there's going to be a parade, or there's a meeting, and issue an invitation for those as well. And then again, the thank yous. I'm not going to go through the leave behinds. They'll be available to you, other than to say that we're going to have some state-specific one-pagers, which is going to be really great, and that will be really helpful. And then we'll do our own AIDS budget and appropriation stuff, and then obviously continue to follow up with the staffer. The maintaining the relationship is really important. All right, I'm going to stop there. I see Max coming on. Jenny, I don't know if you've got any quick thoughts about this.
I think I was going to talk a little bit about engagement if we can't do, right, Max, if we can't do like a traditional meeting. Because sometimes you're going to ask the district staff for a meeting and we're on a fast timeline. They're getting a lot of requests right now, and they might be like, we can't meet you till July because so many people have asked for meetings. And, we know that our bill might get voted on in the Senate, in June. So, one of the things you can do is think of different ways to engage. So, first of all, we're coming up on, you know, HIV testing day. There may be events going on. It's later this month. People may be having outreach events. Invite your member of Congress or your district director from the congressional office from your district to come and join you at an event that you might be having. It might be an HIV testing day event. It might be a roundtable that you want to host. It might be another kind of community meeting. It's Pride. There are tons of Pride events going on. Invite your members of Congress, especially your friendly ones, to things like that if you want to lobby them that way if they're not available. Otherwise, to you because of scheduling. It's just too much competition. We're going to be protesting, I'm sure, whatever bill, if anything, does pass in June during the July 4th congressional recess, and that's the week of parades and barbecues. So look for your members of Congress or their staff showing up at those community events and go bird dog them, go meet them, go talk to them, go up to them, introduce yourself, shake your hand, say the things in the meeting that you would have said otherwise, maybe just in briefer format. You can do that as an individual. You can bring a couple of folks with you that you would have brought to the meeting anyway. There are ways to engage with folks that are, already happening public events that can help you get in the door, so to speak, if you need to talk to somebody earlier. Sometimes you might just want to. Barb told a great story about on the Hill, how she just showed up in an office yesterday. It was a terrific story. Sometimes you just show up and do a drop off. You drop off your packet, you engage someone in the office in a friendly and pro-social manner, and you tell your story that way. If you're running a clinic or an ASO, you invite people to visit your services that you're providing. Again, that could be combined with HIV testing day or another important event happening with Pride. Invite people into the things that these dollars fund to see how important they are. And my suggestion, having done many, many clinic visits with congressional staff and others and members, let them meet if it's an appropriate thing to do in that contact with that member. Let them meet some of the folks that are receiving the services and hear directly from them about how they value those services, not just, tour them through the building, but let them sit down with staff, let them sit down with some folks that are receiving care or services and let them hear directly why that is so valuable, because that is worth a billion words of just going to a meeting, like hearing from direct recipients of the services we're fighting for and the programs we're fighting for is just a huge opportunity. So I just want to flag for folks, there are these different ways of going about it during this busy time. Be creative. Creativity pays off. If you need suggestions from us or you want to run something by one of us, we can definitely make ourselves available to talk with you. Not every place is the same, not every member is the same. There are going to be unique challenges and questions, and please ask them. No question is too elementary. And we really want to help you use the time that you have in the community in the best way possible. Thanks so much. Max, I'm turning it back to you.
Thank you so very much, Jenny, for breaking that down as well, and Bill breaking down what takes place as we're trying to set up these wonderful in-district meetings. Again, I love that folks are thinking about different ways that they can also engage the legislators. Think about inviting again to Pride events, invite them to Fourth of July barbecues. One thing also, you may not see where your legislators, they're not as much, especially some of the ones in the opposition, of letting folks know where they're going. But there are some historical barbecues that they go, historical events that they regularly attend. And you can check historically where they do. You can also check Indivisible and ACLU's websites. They at times also post that as well. So definitely look into that. So thank y'all for this training. This is the space that we're opening up for questions. If you want to put your question in the chat, feel free to. If you would also, if you have a question, not a comment, a question, you can come off mute to be able to also ask a question to one of the panelists that you may have around keeping this engaged, the legislator engagement throughout the summer. This is again something that we're kicking off and we want people to continue to have throughout the summer, but this is a part of a long-term plan. We need to continue to have engagement with these legislators. So when we go back to talking, and I saw someone put AIDS Watch, we want to, when you go back to AIDS Watch next year, or you go meet your legislators during the time of USCHA, you're able to say, "Oh, do you remember that event that you went to, or one of your staffers went to, showing all the services that we actually offer?" Those are important things to be able to offer in that time. And then when we come back again, or while some of our folks that are based in DC are continuing to have this legislator engagement, we want to continue to compile how in which these legislators are hearing from us both in district but also in DC. And one of the things, as again, people are thinking about the questions that they want to ask the panel or putting things in the chat, I want to also highlight that our Save HIV funding website was highlighted during the presentation, and it is live. You can go to the Save HIV funding website. To find information about what the Safe HIV funding is, Safe HIV funding campaign is, how in which we're also advocating. You can also see different media engagements that we've had or heard around what is going on in DC and how we're pushing back also to save HIV funding. Also, some of our different letters to the editor and different actions people have been taking to again try to save HIV funding and defend Medicaid. And then in the future, you will also see access to videos, and different toolkits that we have for folks. So, and like Michael just said, an action alert will be live on the website starting tomorrow. I am still trying to stay in touch with the chat, but if anyone sees questions in the chat that they would like to answer from our panelists,
I
please.
have a question that I'd like to ask. Um, I'm a long-term
Can you state
survivor.
your name, please? First,
My name is Gil Kudrin. I am with ACT UP Cleveland and Night Sweats and T Cells. I was probably infected in 1978. We're having a awareness demonstration today about the threats to our funding. I would like to ask is, I got on here hoping to hear more than just AIDS Watch. We're working with our Congresswoman Chantel Brown to lobby our local governments to put in place emergency preparedness plans for if they do make cuts, be it to Medicaid, be it to Ryan White Part A, Part B, so that nobody goes without meds. We cannot this is beyond what our Congress people can assure us we won't lose. And I hope that's a part of the plan is that some of these answers are going to happen locally. That's what I'm hearing from my Congress people in Ohio when I went to AIDS Watch. So we're trying to put plans together locally. I hope you guys can give us some direction with that too. That's why I joined today. So I joined in today so I could hopefully hear some of that because the answers aren't all in Washington. We cannot control the budget. And I want answers so my long-term survivor friends aren't dead next year at this time.
Thanks so much, Gil. It's good to see you. Yeah, I think you're right. There definitely needs to be sort of an all fronts approach to this, and we should be talking to our local jurisdictions. That's the city level, county level, the state level, especially, and we are kind of focused on the federal level in part because that's we need to prevent as much of this cutback as we possibly can, and the state and the local levels, in some ways, also are dependent on that. But I don't disagree, and I think all of these techniques can be used with those same office holders in the state and local jurisdictional level. So I think you're right on the right trail. I definitely encourage people to do that, and I'm happy to talk more with you. I know you know how to get in touch with me, and we can definitely be in touch about that. And others may have more thoughts about that, but that's absolutely a good message for us to hear to use these techniques not just with the federal level.
Yes, please. I'll put my phone number in here. We in the chat, we cannot wait for the feds to fix this. I will die. I've got maybe 6 months to a year tops without my meds. And we know what most people are going to do if they get a cut to their meds, they're going to start taking them every other day to try and drag it out. You can't recuperate. We know what's happening in Africa. People are going to start dying really quickly. And I hope to hear more about that from you. So, Bill, please call me. I would love to have further discussions because we're not going to let that happen here.
Thanks, Gil.
Jeremiah.
Thanks for a great training, everybody. And again, this is going to be a long battle, unfortunately. So, definitely open to other suggestions on additional trainings and additional things to put into the mix going forward. I did want to lift up a question in the chat from Julie asking about rescissions right now. And I see, Jenny, you just put a comment in the chat, but wanted to lift that up here in case you wanted to answer it in the main group.
I'm happy to try to answer that. So there is a rescission package that is being considered. It right now is focused on global aid and including PEPFAR and HIV aid. I just was briefed by some Senate staff about that process, and hopefully, they're really trying to work with some like-minded Republicans to actually stop that bill from being even voted out of committee because they don't want to open a spigot of rescissions packages from the administration coming up on a weekly or daily basis as a way for them to implement the illegal cuts and delays that they've already implemented for federal funding. We're learning more about this process now. This is a very dynamic thing. And I think that, the talking points basically are like, this is not appropriate to rescind these funds that Congress has already approved. And, Congress has made this decision and it is not, for the president to decide. Congress has the power of the purse and for all of us, we don't want, again, like to start with a rescission package like they did with dismantling the current agencies, especially in that area, by passing, and then it'll just turn on the spigot, and every week we'll be fighting a new rescission package. The good news is Congress can just not act on this as well. And likely it would just die. But again, like this is a very dynamic process, and we're working with other coalitions and this, appropriations staff and senators and congressmen to try to be able to push the message that will work the best for the given situation. And so that's sort of the thinking right now, but it is dynamic. And we can talk about this a little bit more on Tuesday for those who join our Tuesday calls too. Does that sound good?
Yes,
Okay.
thank you so very much,
you.
Jenny. Before we get to Jeff's piece, I do want to make one comment around what Gil has said. I do think it is very important that we advocate to our local and state districts to be able to make sure that people are getting the life-saving medications that they need. But I also understand that that would also leave a lot of people not having services, especially in a lot of red states, and would leave a lot of them without access if we do not advocate for this federally. The only way that we are able to, in most city local jurisdictions, I even know they're trying to raise the amount of money in Cook County and Chicago. But this is a lot of those jurisdictions are also cash strapped, and also different states have rules on how much money and them balancing their budgets. We need the federal funding in order to make sure that everyone has access to their medications. And I will pass it on over to Jeff for our final question.
Thanks, Max. Thanks, everybody. Great presentation today. Could you speak to Bill, maybe to, or anyone, the effects on 340B? Where does that live? Is it something that we need to advocate for? Is it something we want to keep quiet about? Maybe it'll slip under the radar. I don't know if there's anything specific. I mean, because it feels like that could decimate even further, services that we rely on and take for granted.
Thanks, Jeff. Yeah, Ryan White programs in particular, but federally qualified health centers as well, all rely on the additional funding that comes through the 340B program that they're eligible for. We definitely have been working with clinics and providers specifically to bring this up. That it actually would compromise the ability of some of the clinics to stay open should there be a major change to 340B. I will say that I have not heard that a 340B change is on a fast track right now. Certainly not in comparison to like reconciliation and or appropriations, but we're definitely trying to keep an eye on it. I will also say that that's a space that has um, a lot of different advocacy groups within it that are very capable of also wielding their ability to fight. So, in some ways, you've got a lot of the hospital associations versus the pharmaceutical companies. So in some ways, we felt like we'll weigh in when we need to, but our energy has been sort of focused much more on these very direct, impactful cuts. But should there be major cuts to, say, the Ryan White program, which actually, interestingly, the president's budget really focuses only on Part F, not on, for example, the Part C clinics or things like that. But should that become an area of concern, that the 340B funding goes right along with that. Any decline in that also creates a decline in part in 340B. So we're very aware of it. We're following it, and we're not quite at the point where we're feeling the need to like go all out yet. Did that
Yeah,
answer?
great.
Yeah.
Yeah, thank you.
Thank you so very much, Bill. Thank you all for joining us for this important training around in-district legislator engagement. Our next training will be June 17th. That is 2 weeks from now on a Tuesday. So we don't interfere with holidays. But it will be next 2 weeks from now, June 17th, 2 p.m. on that Tuesday. Thank y'all so very much. Thank y'all for being here with us. Look out for more emails and updates around the Save HIV funding. Please visit the website and look out for a follow-up from us. And before we shut off, I will pass it back over to Bill.
I just want to urge people to go out and set these district meetings up. Just go do it. And we're going to get that stuff up there. If you need help, contact us. We want you to get out there and just be your dynamic selves and do what we've done since the early days, which is advocate for the resources that people living with HIV need. So I'm so grateful to all of you for being here. We can do this. It's a winnable fight. Turning it right back to you, Max.
No problem. Thank you for that pitch, Bill. Again, if you have any problems, you have any thoughts around what you need around setting those in-district meetings or future work around that you're just trying to, future actions that you're trying to take around saving HIV funding, please reach out to us. Thank you all also very much, and have a good rest of your day, and keep the fight on. Thank y'all.